Hi, this is Dr. Jennie Byrne. I'm an adult psychiatrist at Cognitive Psychiatry of Chapel Hill. And today I wanted to talk with you a little bit about some different kinds of depressive episodes. So first of all, what's a depressive episode? A depressive episode isn't just I had a bad day and tomorrow I'll feel better. Depressive episode is when you feel really down in the dumps for more days than not for at least 2 weeks. And you typically have other symptoms like low energy, poor concentration, eating too much or too little, sleeping too much, too little, feeling guilty, hopeless, worthless. These all go together to kind of form what we would call a major depressive episode. So there are different kinds of major depressive episodes. The three that I would talk about today are something that we would call an adjustment disorder. These are kind of the technical terms, or a complicated bereavement, or major depression. So the first kind, adjustment disorder, this is a kind of depression where you are directly responding to an episode in your life, something that has happened to you that was stressful, such as moving, getting divorced, getting a new job, having a child, some sort of very specific episode in your life, and you are reacting to it. And it is taking you more to adjust to this situation than it would someone else. So again, moving is stressful for everybody, but your reaction is greater than others. You're having a major depressive episode, and it's in the context of adjustment. So sometimes we call that an adjustment disorder with depressed mood. Another kind of depressive episode you could have would be complicated bereavement. This is when someone close to you has died and you are grieving their loss, but your grief has progressed into a major depressive episode. So again, it's normal to be sad. It's normal to have depression when somebody that you love dies. But when it gets into these weeks at a time where you're not functioning at all, you're not getting out of bed, you're not going to work, you feel like dying, maybe you have thoughts of death, this is when it starts to get into a major depressive episode. So that's kind of a second kind. Then you have your third kind, which is where you have major depressive disorder. And that's where there's no it's not really within the context of an adjustment necessarily, or you're not grieving, but it's really part of major depressive disorder, which is when you have these depressive episodes, and sometimes they can just come out of the blue. Like everything's going fine, your life is good, and all of a sudden this hits you and you don't know why. That's typically part of major depressive disorder. So why does it matter, what kind of episode it is? Your treatment and your prognosis might be different for the different kinds of episodes. So if it's major depressive disorder, it's important to know that because it might happen again. You might have further future episodes and you want to know what to do. If it's bereavement related, it's probably related to that loss. And it's not something that necessarily will keep happening over and over again. If it's adjustment to the life stressor, as you start to adjust, in theory, some of your symptoms might get better. So all of these can be treated with psychotherapy, sometimes medication. The treatment modalities aren't really that different necessarily, but sometimes it's helpful to know what the different types of episodes are. In particular, if you have that question like, well, is this going to happen to me again? That's what I think most people worry about. So I hope that's been helpful to kind of go through a few different kinds of episodes. If you need any help, please feel free to contact us below. Thank you.